The sciatic nerve can be pinched in several places. The most common place of pinching is the intervertebral disc at the exit point, where the nerve root can be compressed by a hernia. The sciatic nerve is formed from several roots of the lumbar spine and further passing through the buttock area goes into the leg. When it is pinched by a hernia or piriformis muscle, at the site of compression, the sciatic nerve begins to slide poorly, there is swelling, and the nerve nutrition is disrupted. To significantly improve the situation, you can perform the technique of mobilizing the sciatic nerve according to Michael Shacklock. Michael Shacklock is a very well-known Australian manual therapist, and he has developed his own method, which is now recognized all over the world, called Neurodynamics. His main discovery was that nerves do not stretch, but rather slide through tissues during movement. And in our body, there is a small reserve of nerve movement. When you, for example, stretch your arm, for some time the nerve seems to stretch from the reserve, but at the extreme amplitude, when you are really stretching, it begins to first stretch and then pull out from the spinal column. The entire nervous system is one. And Sheklai proved that in extreme positions, if we stretch a nerve, we can stretch the entire nervous system. One of the interesting experiments showed that if a person throws his legs up, then through the tension of the sciatic nerves, even the eyeballs are slightly pulled up through the optic nerve. That is, we can shift the entire nervous system towards the lower extremities. And such a small movement of the nervous system gives us the opportunity through the extreme position of tension to slightly wiggle the nerve in place of compression, which significantly reduces its swelling and improves blood supply. Before performing this technique, it is desirable to perform manipulations and exercises from our 2 videos about freeing the sciatic nerve, because in these videos we show how to reduce pressure on the nerve. But after we have reduced the pressure on the nerve, it would be healthy to wiggle this nerve. So first we perform the exercise from the video, then this technique. So this is a technique for those who have a pulling sensation in the leg below the knee joint, or numbness in the foot and toes, or shooting pains in the shin area. Most often it is difficult for the patient to bend over because as soon as they bend over, the sciatic nerve is stretched and an unpleasant sensation is felt. This tension arises because when bending over, the nerve tries to move, but it is somewhat pinched. First, after performing the exercise, we slightly stretch the sciatic nerve and then try to move it further. To move it, sit on a stool or table. Place your sore leg on a support lower than where you are sitting. If you find it difficult to stretch your leg in this way and symptoms are already appearing, try to sit a little higher or make the support lower so that you don't have a stretch in your leg when you sit down. Next, we start to lean slightly and round our back until we feel sensations in the leg. When we feel a stretch in the leg, fix the body and only extend the head. If everything is done correctly, then when you extend your head, you should feel a decrease in the stretch in your leg. Next, try to tilt your head again until you feel a stretch in your leg. Try to play with this feeling and see if it can be consistently reproduced. Next, we will connect the foot. Here we need to synchronize the movements of the foot and neck. It's very important not to play with the whole body, but to get to the level of feelings and synchronize the foot with the head. The head bending will synchronize with pulling the foot towards yourself. And again, the foot away from yourself, the head down, the foot towards yourself, the head up. Each time it's very important to reach the painful sensation. Repeat this smoothly in the amplitude that works. Usually, if everything goes well and correctly, then after 5 to 7 movements, you can feel that the pain has decreased and you can lean a little lower. Lean lower again until the sensations appear and repeat the movement again. All you need to do is perform about 30 movements. If everything is going correctly, then every few movements will be slightly easier and there will be a chance to lower yourself a little bit more. After 30 movements, lower your leg during and after the exercise. You may feel a slight numbness in the leg or warmth or a change in sensitivity. This is normal. After you have done the exercise, you can stand up and try to bend over. Usually the bend significantly improves and the shooting pain in the leg decreases. This exercise can be done up to 5 times a day with fairly severe symptoms. Don't forget to perform preliminary unblocking of the sciatic nerve with exercises from previous videos. Usually the problem with the sciatic nerve is quite long-lasting, and you will need to do these exercises for several weeks, but I hope they will bring you quick relief and stabilize the condition of your spine. If this video helped you, give it a like, subscribe to the channel, and tell your friends about it. I will try to answer all your questions in the comments. Until the next video, goodbye everyone.